COVID-19 myths that you shouldn't believe. We are living amidst a global pandemic and the biggest threat to human history in the past 100 years. And while we struggle to adjust to the new normal, there is an entire host of information on the internet that may not be true. In such uncertain times, it is necessary to learn the true from false and distinguish the fact from the myth. In the light of that, in today's video, we have debunked some of the most common COVID-19 myths. Keep watching to learn more. Here are some of the most common COVID-19 myths that you shouldn't believe. Number 1. Only senior citizens and older adults with underlying medical conditions are at the risk of COVID-19 infections and complications. This is partially true. While senior citizens and older adults with underlying medical conditions such as heart diseases, diabetes, asthma, obesity are much more likely to get severely ill, coronavirus can transmit to people of any age. Although, according to WHO, people under 35 and especially children are less likely to become severely ill due to COVID and develop complications that can lead to death. However, regardless of this, everyone should follow public safety rules, wear masks, and practice social distancing. Number 2. COVID-19 can be transmitted through mosquitoes. This is false. Even though the coronavirus is airborne, it cannot be transmitted through mosquitoes. In other words, mosquitoes are not the carrier of this disease. There is no evidence supporting that COVID-19 spreads to humans through mosquitoes. The virus only spreads through droplets from sneezing, coughing, or a patient's saliva. Number 3. Face masks are enough to protect against the virus. While wearing face masks is crucial as a preventive measure, it is not enough to protect you from the virus. Cloth masks and disposable surgical masks are enough to protect you against contaminated droplets, but they can't protect you against aerosolized particles. The CDC has advised that all people should wear masks in public, where it is difficult to maintain a 6-foot distance. However, in addition to wearing masks, one should follow other precautions such as physical distancing, washing hands frequently, and avoiding touching the face. Number 4. COVID-19 is transmitted only in cold climates and not in hot and humid climates. This is one of the first myths that surfaced concerning the coronavirus. But this is untrue. The coronavirus can be transmitted in any kind of climate and temperature. No matter where you are or what kind of climate you are in, you are susceptible to contracting the virus. Thus, no matter what, one should follow personal hygiene such as cover your mouth when you sneeze, yawn or cough, wear a mask and wash your hands frequently. Number 5. Is there any drug or antibiotic that can make you immune against the virus or protect you from it? At present, no drug or antibiotic can make you immune against the coronavirus or protect you from it. Only the vaccine can do so. Besides, antibiotics can only kill bacteria and not viruses. Patients have to receive proper health care and support to alleviate the symptoms of COVID-19 to successfully recover from it. Number 6. Eating garlic and onions prevents COVID-19. This is one of the most common COVID-19 myths, and this is false. Even though garlic and onions are known to have microbial properties, there is no evidence supporting that they can prevent you from contracting the virus. Number 7. Thermal scanners or thermometers can detect the virus. False. Thermal scanners and thermometers can only detect when someone has a fever or a body temperature above 97 degrees, which is one of the symptoms of COVID-19. But fever can result from several health issues and not just coronavirus alone. The only way of detecting if someone has COVID-19 is through a proper COVID test. Besides, symptoms can appear anywhere between 2 to 14 days after you contact the virus. Thus, if the person catches the virus, they may have a normal temperature for the first few days. Number 8. Drinking alcohol can help prevent COVID-19. Nothing prevents the coronavirus except following personal hygiene and safety rules such as wearing face masks, practicing social distancing, and washing your hands. Thus, this is false. Drinking alcohol cannot kill the viral infection and thus prevent you from COVID-19. Number 9. Rinsing the nose and mouth with saline products can kill the virus and protect against COVID-19. This is false. There is no evidence supporting that saline nasal rinses or similar products protect against COVID-19 and respiratory problems. Carr's research suggests that a nasal rinse may ease some of the symptoms of acute upper respiratory tract infections, but scientists have concluded that this doesn't protect against the virus. Number 10. Home remedies can protect against and cure COVID-19. Home remedies may provide temporary relief from some of the symptoms of COVID-19, but they can't protect against COVID-19. This includes essential oils, vitamin C, sesame oil, fish, garlic and onions, water, crystals, sage, etc. The best approach you can take to stay safe from COVID-19 is to take care of your hygiene. Wear masks, avoid crowded places, washing hands frequently, and ensure social distancing. These are all the COVID-19 myths you needed to know about. Stay safe and take the vaccine when it's your time. For more such videos, subscribe to our YouTube channel. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.